What's up everyone, and we are back with another video. And of course this video is going to be all about my surgery regarding the cerclage that I got placed at 16 weeks. If you have not watched that video yet, I'll go ahead and leave a little, you can go ahead and click it, something up here that's gonna take you directly to that video. You should watch that one before you watch this one, just because it'll make more sense. But with that being said, let's just hop in straight into the video. Alright, so I had to get a cervical cerclage placed at 16 weeks, 4 days after they did my 16-week ultrasound, and it was considered an emergency surgery, which I was not prepared for. I was not expecting, but I am thankful that they caught that on really early, and I've been able to grow and carry my baby girl, hopefully for 36 weeks at least. So I'm just going to be explaining a little bit of how my surgery went and what kind of to expect when you go in for the surgery. It was early in the morning and they required you to not have any jewelry on. I did have to take my nose rings off. I have to take my rings as well. Since it is a surgery, they do also require you to, what's the word that I'm looking for? You're not allowed to eat after a certain period of time, or drink water or anything in general, or anything like that. So you do have to go on an empty stomach, which is, it's not that bad, but like, you know, when you're pregnant, you just want to keep eating. Also, they require you to not have any makeup, no contact lens. It's pretty much like any other surgery. Okay, so after I'm fully undressed and all of that, my doctor comes in and he pretty much goes through the whole rundown of what to expect. I did ask if it was going to hurt. It is more of a lot of tugging and pulling. You cannot feel anything after the spinal is put in place. So the way that my doctor does it, mine tried to do it as high as possible on my cervix instead of just doing it at the tip, just in case. Like I said, every doctor works differently. This is the way he does it, and he also mentioned that he has done about 100 cerclages before and they've all been successful, or at least have made it past 27 weeks. Knowing that made me feel really comfortable that obviously that I was in good hands, and I knew this is going to be successful on my behalf too. He did give me an understanding that it can be a different case for every patient. For example, if your mucus plug has already came out, there's times where a doctor won't even bother doing a cerclage, because when the cerclage is placed, it'll shut everything. The chances of bacteria going up are higher. There's also times where a patient might be already dilated. Obviously, every surgery has its risk. Every doctor can tell you totally, completely different things, but the fact that I was a candidate to get a cerclage in place obviously was the best option, so we decided to do it. So after we talked for a couple minutes, still in the waiting room, the anesthesiologist, am I saying that right? Oh god. It's going to come in, they put the IV, they place it, everything, and they literally wheel you out into a white room, like those white operation rooms like any other movie. I'll put like a picture here of what it looks like. It was scary. I mean, you only see it in the movies unless you're, you know, you're there. And I probably would have haven't even seen their room at all if I was able to have gone under full anesthesia. Obviously, they only did the spinal in my case. How they place the spinal is through your back. They make you get in a like crouching position like this. So if you've gotten the epidural, you know how you're supposed to post yourself and sit, and they go ahead and inject it. Honestly, this is what scared me the most, but it tickled for the most part. If you guys have kids already, you know when your kids are playing with little cars behind your back and it tickles, it just feels like that. But obviously you're not supposed to move at all, so it was really hard to stay still in general. And after they place that, they have you wait for at least 5 minutes, so everything just goes directly down to your feet, and you slowly start feeling your legs go numb. It all happens so fast. What happened to me after my legs fell asleep, I felt like I was peeing myself, and I mentioned it to the nurses. I told them I feel like I'm peeing myself. Like, is that normal, or is that part of the whole anesthesia thing going on right now? So I did get a catheter placed in me. After that, they make you lay down. Obviously they help you, but also please keep in mind that it also depends how far along you are, because usually when they do a cerclage, you will be put completely under, so you're not fully awake. It all depends how far along you are. It all depends on, it could depend on a lot of things. This was obviously my case. So yeah, I was fully awake. They made me lay down, and you just see these bright lights shining down on you. It is really cold in there as well, like really cold. I could not stop shivering, even though they did give me like 30 blankets, but they weren't doing much because hospital blankets don't really, they're literally like a napkin. After they laid me down, they lifted my feet up and hung them, so I was, you know, just exposed. At this point I could not feel a thing. Like, I was completely numb. I could feel pulling and like them trying to position me, but I couldn't really feel anything at the same time, if that makes any sense. I am a small girl. I am like 5'3". They pretty much have to lift me all the way up where my booty was all the way up here and my head was down here. So I was pretty much like this, my head being over here and literally, you know, like this open over here for the doctor, which was where he was going to sit. And I kid you not, I was slipping back on the bed, and I kept telling the nurses, I'm like, yo, I'm falling, like I can feel I'm falling. They're like, no, you're fine, you're fine. I'm like, no, trust me, I can feel my body weight just slipping down slowly. So what they did is they strapped me down with my arms, so I was like if I was laying on the cross, and they strapped my hands down, but I could still feel myself falling. So they had to recline me a little bit more forward, just because I'm sure the doctor couldn't reach. The surgery itself took around, I want to say 30 minutes. I could feel him pulling things. I could feel him tugging and all of this, and it was really, I feel like because of the fact that I knew that I was supposed to feel that, I mentally felt it, because physically I couldn't feel anything. So, but mentally I knew what was going on. He was able to successfully do it. After that happens, they will come in and transfer you to another bed and take you to a waiting room, and this is where the waiting game begins. Your legs are fully asleep for about 1 or 2 hours. It depends how fast it gets out of your system, and just the feeling alone of being paralyzed is so frustrating. When they laid me on the bed, they kind of threw me in a little awkward position where I was not comfortable at all, and I could not move. I couldn't move. I was practically paralyzed, right? They did the spinal anesthesia, so obviously I can't move at all. The next step was to go pee. Because you get the spinal, sometimes people have issue going to the bathroom. So that was one of the main checkpoints that I had to accomplish before I left the hospital. Like, they wanted me to go to the bathroom before leaving. Of course, my legs took forever to wake up. Anesthesia ended up wearing off first in my toes, my feet, so I was able to move my feet, but I could not get up fully. So that was a waiting game. Though, like I said, the surgery itself took like 30 minutes, and just me waiting for my legs to fully wake up took another 2 hours. Once I felt full movement of my legs, I got up and the floor felt like it was melting. It felt really weird. Obviously they assist you to go to the bathroom. I was able to go to the bathroom, everything was fine. It was not painful at all to go to the bathroom as it is after you give birth. Nothing like that, thank God. Went to the bathroom, came back, relaxed a couple more, waited out for everything to fully wake up, and then we got discharged. So after getting discharged, my back started hurting a lot. They do give you a prescription that you can take. They do give you pain medicine. They gave me, I believe, like 3 different pills for the pain, and I took it before I left the hospital, and then I went home. And pretty much the most comfortable position for me to be in was laying down, because if I sat up I could feel sore. And my back, of course, my back was the one that was hurting the most. So the first day went by and the only thing that hurt the most was my back, and it did just feel like really heavy and sore inside. The pain wasn't as bad, it was just really uncomfortable, but I did end up taking a pain medicine like I said. The second day, same thing, my back was still hurting. I did take another pill, and spotting is normal after this procedure. So I did go to the bathroom and there was some spotting. They told me not to freak out, that it's normal just because they stitch your whole cervix, so some spotting is expected. This is something they also tell you before. For me, it didn't happen right away. It did happen until the second day, and I believe it was only like 2 or 3 times that I went to the bathroom, and then the spotting completely stopped. After the 3rd day, everything was fine. Everything was back to normal. They do require you to be in bed rest for the first 24 hours, which is what I did, but the pain is not bad. Like it is uncomfortable, but it's not bad where you can't get up by yourself. You can still do all that by yourself. They just do mention to take it as easy as possible. Well, after about 4-5 days pass by, everything is back to normal, everything is fine, but I did notice that I could feel my cerclage. It felt like, this might be TMI, but it did feel like when you put in a tampon in and you put it on wrong and it feels, there's like discomfort. That was what I was feeling. It wasn't all the time, it was sometimes just the way that I was sitting. So that was one of the things that I noticed after they placed this. Right now though, I have no issues. There is times where it feels like I am sitting on a tampon, but of course it's still cerclage. But besides that, I have not had any more spotting. I have not had any more complications. The only thing that sucks is that you can't do anything with your partner just because the cerclage is in place. So all of that is off the table for good. There is none of that happening, of course, until after they remove it, then, you know. But that is not even my main worry right now. It is what it is. As long as baby girl gets to grow in there, it don't even matter. Yeah, that was pretty much the whole overview of the surgery itself. What to expect after recovery as well. It's a pretty smooth surgery, I would say. Also, when I was in the surgery room, they did play Christmas music since I was awake. The nurses didn't really know what to do. They were like, well, usually our patients are fully asleep, but we'll try to make it comfortable. We can play some music for you, which is what they did, and it was really nice of them. So I was there getting a whole surgery while Jingle Bells was playing in the background. Thank God everything went well. Thank God they caught it on early, and it's been successful since. The surgery is not bad, like I said, so do not freak out if your doctor has mentioned that he wants to do, or she, a cervical cerclage on you. It's going to be okay. So with that being said, if you guys did enjoy today's video, make sure to give it a like. Also make sure to subscribe to stay updated in my pregnancy journey, and I'll keep making more videos. Got a little lightning. I'll keep posting more videos as we grow. So with that being said, I'll see you guys next time. Peace.